Welcome back. This is the Dentist News Network. I'm Scott Drake with my guest, Dr. Glen Doyon with the Center for Microsurgical Endodontics in Scottsdale, Arizona. Dr. Doyon, welcome back.
Hi, Scott. How you doing?
Again, I want to clarify what endodontics is. It's root canals. People usually present themselves with some kind of pain. I think other dentists, other than endodontists, do that procedure. Why doesn't somebody just go to their own dentist?
As far as who can do a root canal, any licensed dentist can do a root canal. To become a root canal specialist, an endodontist requires an additional 2 or 3 years of training. I think that doing endodontic treatment is a little bit like performing brain surgery on a tooth. The teeth are exceedingly complex. They're snowflakes. Everyone is different, although they're very similar. One similar tooth to another similar tooth is similar. They're all different. They're all complex and complicated. It requires a great deal of skill and experience, and certainly lots of dentists have developed that. I think that a couple of years devoted to that kind of training is crucial for any complex case.
Many patients may present themselves to you with a problem, but may not have the pain, may not have the symptom that tells them that they have a problem. For example, an abscess. Can you talk about that situation?
Yeah. Well, people do seek treatment when they're swollen and when they're in pain. There's no doubt about that, and that's what we're here for. People often require treatment when they're asymptomatic, when they don't have symptoms. Lots of times in an examination by your dentist will, on radiographic examination, discover that there's an area of damage to the bone surrounding a tooth, and it's coming from a tooth that requires root canal treatment. For the most part, those kinds of situations can remain subclinical. What I mean by that is unaware to the patient until, just like a heart attack, one day a patient wakes up and says, I'm having such a terrible toothache, and they enter my practice. But before that, they may be recommended for treatment. You might be recommended for treatment because of something that's seen either clinically or radiographically by your dentist. And actually, that's a good time to take care of it, because the biggest predictor of postoperative pain from having treatment is preoperative pain. So if you present for care and you're not in pain, the chances of having pain from root canal are minuscule. And so a lot of my people come into my practice, have root canal therapy, and it's like a long, dull, boring, easy filling. It's really a non-event.
Typically, after a root canal, the next step is generally a crown. Are there situations where a crown isn't needed?
A crown is not always the next step after a root canal, but in general, what drives the need for root canal treatment is decay or damage to the tooth. And if a tooth is damaged significantly, a crown is required to restore that tooth, restore the integrity of that tooth. In general, in the teeth in the back, the posterior teeth, not the front or anterior teeth, but the teeth in the back that have root canal treatment do get crowns. Sometimes if somebody's traumatized, kid riding on his bicycle falls, bumps his tooth, that tooth requires a root canal, but the tooth is not damaged in any way. It just happened to be concussed, received a blow. We can do the root canal treatment on that tooth and never do anything except repair the access to the root canal system. It doesn't need a crown.
All right, Dr. Doyon, thank you.
You're welcome. Thanks a lot, Scott.
My guest has been Dr. Glen Doyon with the Center for Microsurgical Endodontics in Scottsdale, here on the Dentist News Network.